Anyway, thank you everybody for coming. Everybody who's here live, and everybody who is watching this on a video or streaming subsequently. My name is Bruce Grossberg. I'm the chair of the Aging, Social Services, and Disability Committee of Community Board 6 Queens, which covers the Forest Hills and Rego Park area. Tonight we're doing a webinar called Nursing Homes After COVID-19. We have two panelists here tonight. Welcome to Richard Mollett, who's the Executive Director of the Long-Term Community Care Coalition, a United States-based nonpartisan nonprofit organization dedicated to improving care for individuals in nursing homes and other residential care settings through legal and policy research, advocacy, and education. Richard has researched and published on a variety of long-term care issues, including dementia care, nursing home and assisted living standards, the rights of older adults in residential care, abuse, neglect, and crime in nursing homes, nursing home financing, and the imposition and use of penalties for substandard residential care. He's a graduate of Howard University School of Law and a member of the Maryland Bar. Richard, thank you for being a part of this with us.
Thanks. Thank you.
We're also pleased to have our state senator, Joseph Piedabo Jr., who was elected to the New York State Senate in 2008 after serving 7 years on the New York City Council. State Senator Joseph Piedabo Jr. continues to proudly carry on the public service tradition of his father, Congressman Joseph Piedabo Sr., who served 13 terms in the United States House of Representatives from 1960 to 1986. And at a point of personal privilege, I'll note that Congressman Adabo was my Congress member when I was a boy. Senator Adabo is a lifelong resident of Queens. He represents the 15th senatorial district, encompassing the communities in whole or in part of Lindenwood, Ozone Park, Woodhaven, Glendale, Maspeth, Middle Village, Rego Park, Forest Hills, Kew Gardens, Richmond Hill, South Richmond Hill, and South Ozone Park. In the state Senate, Joe has continued to make constituent service a priority, just as he did as a representative of the 32nd New York City Council District, where he secured millions of dollars for infrastructure improvements, school technology, and senior and youth activities. Through his Senate offices, Joe and his staff have assisted thousands of constituents with problems involving housing, health, transportation, taxes, public safety, and many other issues, including efforts to aid local residents whose lives were so deeply affected by Hurricane Sandy in late October 2012. As a member of the Senate Bipartisan Task Force on Hurricane Sandy, Joe worked to help his community recover and rebuild from the devastating storm. As a member of the Senate, Joe is deeply concerned with the welfare of New Yorkers in all stages and walks of life. Joe's legislative record, which includes bills he's introduced and supported, reflects his commitment to fighting on behalf of children, the elderly, families, working people, consumers, and veterans. He's also devoted himself to efforts to protect the environment, to create new jobs and economic opportunities for small businesses, provide tax relief for state residents, and improve transparency and accountability in New York government. As state senator, Joe is well known for organizing and sponsoring dozens of community events for his constituents each year, including job fairs for local residents and veterans, comprehensive recycling events, informational sessions for seniors and consumers, health screenings, MetroCard van visits, mobile office hours, Java with Joe, and many other free programs. During COVID-19, Joe and his staff made sure his offices safely remained open throughout the pandemic, assisting individuals with unemployment benefit claims and food availability. In addition to other legislative responsibilities, Joe serves as the chair of the Senate Committee on Racing, Gaming, and Wagering. Through this committee, Joe and his staff are responsible for improving the multi-billion-dollar industry in terms of revenue potential, increased educational funding, and job creation connected to gaming and horse racing operations throughout the state, while addressing the issue of gambling addiction. On January 8, 2022, New York began its mobile sports betting operation, a project Joe and his team worked on for over 2 years. as one of the state's primary advocates. Joe is also a member of the State Senate Committee on Rules, Insurance, Budget and Revenue, Civil Service and Pensions, Education, Veterans, Homeland Security, and Military Affairs. He's also a member of the state's Native American Relations Temporary Committee. Joe's proven himself in the political and civic world. He's a multi-term New York State Democratic Committee member and a ranking member of the South Queens Regular Democratic Club. His community service can be seen in his work on behalf of the Ozone Park Kiwanis as the former president of the Ozone Tudor Civic Association and his past tenure as executive secretary of Community Board 10 Queens. Born in 1964, the youngest child of Joseph and Grace Adavo, Joe attended Nativity BVM School in Ozone Park, class of 78, Archbishop Malloy High School, class of 82, and St. John's University, class of 86, before graduating from Touro Law School, class of 92. Prior to his election to the City Council in 2001, Joe practiced law for 10 years. Joe is married to his wife, Dawn, and they have 2 daughters. Senator, thank you for being a part of this. So we appreciate your coming.
Thank you, Bruce, for the opportunity. Thank you, and hello, everyone.
Hi, everybody. And finally, I would like to introduce you to our moderator, Mark Laster. Mark is a licensed clinical social worker with over 40 years' experience. Mark is the 3rd vice chair of Queens Community Board 6, the co-chair of the Forest Hills Green Team, the clinical and community relations consultant for Together We Can, and Mark helped to form the Central Queens Against Hate group. Professionally, he maintains a private clinical practice. During Mark's career, Mark has worked for both nursing homes and hospitals. Mark is a graduate of Queens College and of Columbia University School of Social Work. Mark will facilitate today's discussion, and I leave the floor to you, Mark. Thanks very much, all of you, for participating.
Thanks, Bruce, and thanks for working so hard to organize this. So the way we're going to work this today is we're going to ask Senator Adabo. We sent both Senator Adabo and Richard Mullet questions that we would like them to address, and they're both going to, go through the questions and address them. We'll give them each about 20 minutes to talk, and then we'll take questions from the floor. I just wanted to mention that the way we had conceptualized this program, we saw the senator is talking about legislative and policy. We saw Richard as somebody who would talk for advocates. We did reach out to the industry. We tried numerous people that we reached out to, and whoever we reached out to from the industry chose not to join us tonight. So I just wanted to make that clear. So I would love to turn the floor over to Senator Adabo to start, to kind of begin addressing some of the issues that we asked him about. So Senator Adabo, please take it away.
Mark, thank you so much, Bruce, and everyone at CB6. Richard, a real pleasure, again, to be on the panel with you. Nursing homes are incredibly, critical for this, providing service for those in need. Certainly on the state level and pretty much any level of government, what you look to do, certainly with nursing homes, is to figure out what you need from the nursing homes. What do you want? Well, of course, we want quality care, want it to be affordable, want to make sure it's sustainable going forward. And you wanted to have safe conditions of this quality care to make sure the needs of the residents there and their families are taken care of. So once you identified certainly the needs of what you want, certainly out of the nursing homes, now what can the government do? And certainly in light of the pandemic, oversight, we can certainly provide oversight in terms of working with our Department of Health, and making sure that the oversight is providing, again, reducing the risk of any needs that the residents may have. We can provide funding, which I think is critical, certainly as we're working through the budget process now. But on a city, state, and federal level, funding is critically important. Strong regulatory standards, and to make sure that those standards are followed on a state and federal level, but certainly a strong regulatory network of standards. Making sure there's accountability. When you provide these standards, we have oversight to make sure there is accountability with the nursing homes. And the staffing levels, I think, are critically important to make sure this is efficient going forward. I think, again, the pandemic provided a lot of insight into what was going wrong with the nursing homes. It provides a blueprint post-pandemic on what we need to do, working with our agencies like the Department of Health. And the Department of Health, within the State Department of Health, there's a division of nursing homes, which, again, we need to work on. They have the authority to investigate complaints, and I think the input there is critically important. So we need to move forward And like I said, right now we have a budget process. I signed on to a letter asking the governor to fulfill our obligations with Medicaid, increasing funding, and avoid cuts. Certainly, there's not a time when people are so in need of quality nursing homes to, again, try to avoid those cuts. So these are some of the things that we're working on. And again, Mark, I appreciate the opportunity. If anybody has any questions, there is a study being done on the state level. That was a law that we passed last year. There's a 4-year plan going implemented currently now. The study should have findings by hopefully next 6 months or so. So there is items in the work, and we're heading in the right direction as a New York State in terms of nursing homes post-pandemic, but there's so much more work to do, both legislatively, administratively, and fiscally. So like I said, generally speaking, we're moving in the right direction, but there is a lot more work to do.
Right. Thank you, Senator. Richard, do you want to talk a little bit about, from your perspective, what do you think is going on with nursing homes? Oh, Richard, you're on. You're mute.
Thank you. Sorry about that. I'm just going to open my slide deck.
Yeah.
And I'm happy to share that afterwards. Why did that not open?
No, wrong
Let's try
one.
that one more time. It says Microsoft PowerPoint. And let's share. Here we go. Okay.
There we go.
And play from start. So, sorry about that. So I think you already mentioned a little bit about us, but we're a nonprofit organization and we're dedicated to improving care for residents in nursing homes and assisted living. We are a small organization, so we do not have the capacity to provide individual case management or services. What we do is policy analysis and advocacy in New York and nationally. Our website is nursinghome411.org, and we have a lot of resources for families and for residents and for those who are working with them. Everything is free to use and to share. This is a clip from a New York Times piece that came out. Actually, it's an op-ed piece that I wrote for the Times. Nursing homes were a disaster waiting to happen. And that is really, it's what I wanted to kind of touch bases on as we are talking about nursing homes post-COVID, and we're still in the COVID pandemic, although thankfully we're not in the health emergency any longer. But the point of the article and some of the things that I think we still need to, very much still need to address in New York and nationally is poor nursing home care, which is too widespread, low staffing, and frankly, misuse of the public funds that pays for most nursing home care. So some of our key priorities now coming out of the pandemic in regard to nursing homes, and I included some assisted living here because I thought that might be of interest too. But in respect to nursing homes, is improving oversight of nursing home care. We actually have really strong nursing home standards in the United States and therefore in New York State. The problem is those standards just don't implement themselves. They require some kind of oversight. We've done a number of studies over the years, and they're available on our website, that have looked at federal data on state enforcement. And what those studies over and over again have found is that the states do a pretty poor job of identifying when residents have suffered, when there's substandard care, when there is an overuse of antipsychotic drugs as chemical restraints, et cetera. What our studies also have found, unfortunately, and this has been pretty persistent over a total of six years of data over 2 studies, is that New York and New Jersey are the poorest performing states in the country when it comes to protecting residents in nursing homes. So that is something that I think that is we need to be very well aware of here in New York. And by that I mean that most states, as I said, do a pretty poor job in identifying when a resident has been subjected to substandard care or neglect or even abuse. And our studies have shown, based again on federal data, many years of federal data, that New York persistently under-identifies when there's short staffing, under-identifies when residents are chemically restrained, under-identifies when there's poor care leading to pressure ulcers, et cetera. So that's a big part of our work, and it has been historically since our start in 1989, is to improve enforcement of minimum standards. We also are doing a lot of work, and I'll talk about this, quickly later on, to improve both financial accountability and transparency. And New York nursing homes make a lot of money. The New York State Attorney General has actually done some really, frankly, groundbreaking lawsuits over the past year and a half that have looked at several providers now, and each one of the lawsuits has uncovered a tremendous amount of often, frankly, fraud, but also a misdirection of money, by which I mean direction of monies received for Medicaid and Medicaid services away from resident care and instead into the pockets of the facility owners. And so until we address that issue, we're never going to, in my opinion, never going to be able to address the problems that residents face, the terrible working conditions that staff face, and the heartache that too many families face when their residents get substandard care. A little bit quickly about assisted living. We're advocating for federal minimum standards and greater transparency. A lot of people conflate or confuse nursing homes and assisted living. There are no federal standards for assisted living when it comes to quality. So it's really kind of a wild west. You could have good assisted living, or you can have a crappy assisted living, and there's really no way of knowing. The only thing that the public has to rely on is marketing from the assisted living facilities themselves. And the New York State Department of Health provides very, very, very little information on the quality records of assisted living facilities in our state. In New York, we want to improve staffing standards for assisted living. Since all the rules pretty much in the country are state-based, we want to see decent staffing rules for assisted living and improving that information so people can actually see and compare the quality of assisted living in their area. I'm not going to go into the bills too much, but there are a few bills that we are monitoring and on which we have taken positions. We don't do a lot of lobbying, frankly, because the rules are, as I said before, for nursing homes in particular, really good. They're just not very well enforced. So when we talk to the legislators, it's about using their position to get the Department of Health to do a better job in enforcing minimum standards and helping us. We get some money from the state, helping us to inform and educate residents and families and long-term care ombudsmen and others who work with residents and families. We have a project now that we would love to get state funding for, that it's ending at the end of the summer, that is focused on helping families in nursing homes and assisted living, form family councils, advocate, understand what their residents' rights are, and advocate effectively for them, in a nursing home and beyond. So these bills are, one was proposed in the governor's in the governor's budget bill to allow certified medication aids in nursing homes. We are strongly opposed to that. The second bill here is regarding the use of psychotropic medications in both nursing homes and adult care facilities. This bill would require that the facilities get informed written consent before the administration of psychotropic medications. As I mentioned briefly, it's a huge issue in our nursing homes and in our assisted living facilities, and frankly, in the community, that a lot of people with dementia are inappropriately given antipsychotic drugs or other sedatives to address the so-called behavioral symptoms of dementia. And that's not clinically appropriate and actually is quite dangerous for those individuals. And again, I'll share the slides, and they have links to the bills as well. And then I think lastly is this bill, which is especially troubling. It also comes from the governor, and this would allow assisted living residences, assisted living facilities in New York State it would set up a means for so-called quality measures for assisted living, which is not in itself necessarily a bad thing, but it would allow facilities that score high on these so-called quality measures to have less surveys. This is really, frankly, catastrophic, or would be catastrophic for residents. As I mentioned before, there are no federal rules. We have generally no idea who's providing care in assisted living, and we don't know about what happens to people in assisted living, except when there is a scandal that's picked up in the New York Times or by ProPublica, which has covered assisted living scandals in Queens in particular. We just don't know. So we rely on the Department of Health, which, as I mentioned before, we know does a very poor job in overseeing nursing homes. The rules for oversight are even weaker in assisted living. So it's very concerning that rather than beefing up, as is needed, the oversight of assisted living, the governor is proposing decreasing the oversight of assisted living. In addition, as I note here, the governor is actually proposing allowing some assisted living to get accredited from an accrediting agency, which is a voluntary agency that works for providers, rather than, and if they do that accreditation, which is outside the scope of any government oversight whatsoever, that they would be exempt from any inspections whatsoever from the State Department of Health. I think it's completely outrageous, frankly. It's so against the public interest for seniors and people with disabilities who have come to rely more and more on assisted living especially over the past 20 plus years, as people increasingly seek to avoid nursing home care, and assisted living has become more of an option for people, including people who are on Medicaid. This is our action center, so people can speak out, for instance, on the informed consent bill in New York State. We also have on increasing the personal needs allowance for people in nursing homes in New York State, as well as our national alerts here are available on the website. I want to just spend a few minutes talking about a couple of the other, actually about a study that we just published in a peer-reviewed journal that looked at nursing home profits. This is a really big issue because the nursing home industry, and they're extremely effective about this in New York State. We have multi-million-dollar industry lobbyists that I think Bruce mentioned at the start. You had reached out to a number of these associations, and they all refused to come today. Those lobbyists are, telling our legislators, telling the governor's office very effectively that they don't make enough money to provide better care, and in particular that they don't make enough money to have better staffing. So we have a couple of alerts that we put out. We just put out this alert on the left: New York nursing home profits. New York nursing homes are profiting as residents and families are losing out. We have another policy brief here. They're also available on our website on Medicaid funding, separating the fact from the fiction, looking at the actual data on Medicaid funding. But I want to just quickly talk about the study, as I said, that was just published in a peer-reviewed journal. It's looking at, it's a national study that looked at nursing home cost reports, what nursing homes are actually admitting to the state and the federal government that they are, where their money that they receive is going. And again, it's addressed the problems I just mentioned, that nursing home lobby associations are saying government rates are inadequate. They're saying that staff shortages make it impossible to hire more nurses, and that nursing homes will close if you require them to do any better. So what we did is we examined 2019 Medicare cost reports. Again, what nursing homes themselves are admitting to how they are spending the money that they receive to provide care through Medicare and Medicaid and private pay. We looked at revenues and expenses, profits and losses. We looked at related party expenditures. What that means is essentially that nursing homes quite often, and we see this over and over again in New York State, a nursing home operator will buy a nursing home, and then they'll sell the underlying property, the property and the building to another company, but they themselves own that company. And then they could charge themselves rent. It's supposed to be in line with what is appropriate for the community, but actually there's no accountability there. So as the Attorney General, as I mentioned before, has had a number of lawsuits where she had forensic accountants that looked at this information and found that nursing homes were shuffling a lot of money through related parties. So we looked at that as well. And then what we found is that most of the money that goes to nursing homes does come from the public. It comes through Medicaid, it comes through Medicare. We have a right as taxpayers to ensure that that money is used appropriately. What we found was, and this I just want to take a minute on, is that nursing homes, again, this is all self-reported and virtually unaudited at all by either the state or the federal government. Nursing homes get about $126 billion a year, this is federally, including New York. they spend approximately $126 billion a year. So if you look at what they're saying, they essentially have a wash. They have, as I note here in the purple, a profit margin of approximately 58%, 0.58%, so less than 1% profit margin. However, and again, this is just based upon what they're admitting in their own cost reports. If you take out the disallowed expenses, for instance, if I own a nursing home in St. Albans, if I buy myself a private plane, taxpayers shouldn't pay for that. That's what's called the disallowed expense, excuse me. If you take out the disallowed expenses, which come to $6.4 billion, 5.7% of all the money they receive, and if you take out depreciation, which is another $4 billion, nursing homes have an operating margin, a profit of close to 9% every year. And what was really striking to me, I've been doing this for over 20 years now, is that I didn't realize that, as I said, we have disallowed expenses, either a private plane, if you have if you're buying yourself Mercedes-Benz and your administrators, Mercedes-Benz and Jaguars, which I've seen actually in Queens and Brooklyn. If you're doing that, it's a disallowed expense. However, what I didn't realize is that the government never takes that money back. So facilities are saying, here, this is what we're doing. This is what we're spending it on. It's a disallowed expense, but no one ever takes that money back. And in fact, rate setting is made based upon these really inflated costs. So there is a lot of money being made. Why do you see this picture? So why did nursing homes say, oh, we have such a small, we're razor thin margin on paper? So one is because a lot of money is shoveled into to profits through disallowances and depreciation. But by doing so, it serves the nursing home industry, not residents, not families, and not taxpayers, but the industry in two different ways. One, it allows the industry to go to the legislators and to go to people on Capitol Hill and the governor's office and say, look, we're making no money, and you can look at our cost reports. And two, if a family sues because their resident that they entrusted to the nursing home dies as a result of neglect or abuse, the nursing home can say, we have no money, because all that money has been pushed out. So that is really the gist of the study that we did. It was really quite striking. We've been meeting with people, we've been talking about it, we'd love to talk to people in the state legislature here, but we have been meeting with people at the White House, at the Government Accountability Office, Department of Justice, and people in Capitol Hill, in Congress, to talk to them about this, because this is all based upon thousands and thousands of records, again, of what the facilities themselves are admitting to. So this is our website. Again, these are some of our resources. We have monthly webinars. Everything is free, and we've been thankful in the past for the state legislature to help us through the funding that we have gotten in the past. That has enabled us to, for instance, translate our assisted living guides into Spanish, to translate some of our fact sheets into Spanish, to do our monthly webinars, to do the outreach to families across New York State. It's been really great to be able to do that. And so please avail yourself of those resources. And thank you again for allowing me to speak about some of this work.
Thank you. So you'll share that PowerPoint with us afterwards, so we can share it out to the committee. That's great. So I just wanted to indicate something. I wasn't planning to talk about assisted living, but Richard, there's a difference between assisted living and assisted living programs. Is that correct? In New York State, there are assisted living programs that you're able to live in and be on Medicaid. Those are different than assisted living. Am I getting that right?
Well, partially. So the assisted living program, and most states, 48 states actually have an assisted living program now, enables people who are on Medicaid to avoid nursing home care and get care in an assisted living facility. But those assisted living program slots are in licensed assisted living facilities or licensed adult care facilities. They have to be.
Right.
So it's a subset, in other words.
Right. Yeah, because I do know that there are some assisted living programs that accept Medicaid, and I do know there's assisted living programs that you have to pay privately for, and sometimes there are situations where if you're in assisted living that you're paying privately for and spend down your assets, they basically discharge you if you can't afford to continue to pay. So I think that's something else within assisted living progress. And that's why I just wanted to draw that distinction. Because I know here in Queens, for example, there's an assisted living and an assisted living program that do work together. That
Yeah,
once they
well, as I
spend
said, they're
money into
housed in it.
assisted
Yeah,
living,
yeah.
they then will kind of transfer you to the assisted living program.
Right.
So I just wanted to kind of bring that up. I know we were going to get that much into it. All right. So are there any questions from the floor at this point? Yeah, Bruce?
Thank you, Mark.
Bruce?
Thank you, Mark. Thank you, Richard. Thank you, Senator Adabo. I I, um I come from this from a little separate angle. I don't have any relatives in nursing homes and assisted living, but I do have a brother who's in a group home for the developmentally disabled. And a lot of these issues parallel. And Senator Dabo staff knows that I keep writing letters on the current budget to try to get more money in for these workers who are not getting paid, uh, and the governor seems to be resistant. So what do you think what do you think that resistance is due to? Do you think she's just trying to save money, or do you think she thinks that the nursing homes could on the assisted living facilities and the developmentally disabled facilities could spend more money on staff if they just wanted to and they just don't want to? How do you think that cuts?
I think, yeah, Bruce, it's a great issue. And I think it's just part of the budget negotiations that a certain strategy every governor has. Propose cuts early, propose lack of funding early, and then obviously go through a budget negotiation. Previous to Governor Hochul, the previous administration actually cut Medicaid during the pandemic. It was the only state, according to the state comptroller, I think December 2023, he put out a report, and he actually said, Comptroller DiNapoli actually said that the previous administration was the only state in the entire country to cut Medicaid during the pandemic. Governor Hochul administration since then has increased funding for Medicaid. She actually, in her executive budget this year, puts in $50 million for nursing home projects and hopefully an increase in Medicaid funding. But I think that's just a budget negotiating strategy that we'll see over the next 5 weeks leading up to the April 1st budget, hopefully. We'll see an increase in that funding, both for nursing homes, for staffing, which is critical, and for Medicaid as well. So I just think it's part of a strategy. Hopefully, when the dust settles on the budget, we'll see an increase in funding for staffing, especially.
Richard, do you want to address that question from Bruce?
Do I want to? I mean, the biggest issue with staffing, there's been a number of studies on it, is that what we know about nursing homes is that there's a very high turnover rate. It's not uncommon to have a turnover rate of over 100%. We track and publish data on staffing for every single nursing home in the country on a quarterly basis when it comes out from CMS. And you can see that nursing homes have over 50% on average, over 50% turnover rate. And as I said, many have over 100% turnover rate. And so it's part of a business model that, in the lack of good standards, is able to persist and grow. Is that keeping your staff low and having high turnover, so that there is you never have people with seniority, you never have people whose salaries increasing. You always have people who are at the bottom of the rung, and so that's we need to change the business model. We need to change the way we're allowing facilities to operate if we want to make those changes.
Okay, thank you, Richard. Pat, you have a question.
Hi there. Thank you very much for the presentation. I had a relative in rehab last February of last year, and this was supposed to be one of the premier places in New York City, and it was horrible. I had to keep staff worked their rumps off, honestly, but it was so understaffed and it was so horrible that people in administration did not want to talk to me. And in fact, the only time the administrator would talk to me was 10 minutes before the family member was signed out of the rehab center, discharged. And when I filed grievances, they wouldn't give me any information on what was going on with the grievances. They kept telling me, "We have your grievance." When I was in rehab myself, I've been in rehab 3 times for after surgeries. And when I've had a grievance, the social worker there would take the grievance, file the grievance for me, and then come back and tell me what the outcome of the grievance was, to the extent that the administrator of the facility sat down with staff and had a reinstruction of staff, or your grievance has been escalated and supervisors are taking notice. Whereas otherwise, they refused to give me any information other than "we have it, it's noticed." And unfortunately, I took ill um, from a respiratory infection, and I did not have an opportunity to file my grievances with the state. But why, how can people get away with this? And what are recourses even a year later? Thank you.
Senator Dabo or Richard, you want to address that?
If I may, Rich, thank you. If I may, Pat, certainly, nobody should go through that. That is, having somebody in nursing home, have somebody in assisted living, it's a stressful enough situation, and no family member should go through that. And in terms of healthcare, it's usually a stressful situation. I encourage people, and that's why I put my email in the chat. I encourage people to reach out to their elected officials, working with the mayor's office, working with the governor's office, using the resources that we have at our disposal. We can follow up. I'm not sure if any kind of the limitations due to the delay here or the time that has passed here elapsed, but nevertheless, Pat, I encourage you to, if you want, reach out to my office via my email, and we can check that out. Certainly, as this situation is ongoing, that's our role as elected officials to work with the agencies, work to use the resources at our disposal to try and again address our constituents' issues. So I do encourage again residents to reach out to the elected officials, reach out to me, please, see if we can help.
Okay, good. Any thoughts, Richard, about that question?
Yeah, I agree. I mean, as I mentioned a couple of times, unfortunately, the State Department of Health doesn't do a great job in oversight or responding to problems, but we strongly encourage residents and families to speak to their local legislators, because that can be really effective in raising an issue. I would also encourage people to contact the Attorney General's office. There's what's called the Medicaid Fraud Control Unit, and they have a patient abuse and neglect hotline that's on the website, and that's a good way to escalate. Speaking to a long-term care ombudsman, if you're in a facility, they won't help you afterwards. They're not able to help you afterwards, but they can help if you or your loved one is in a facility. And then just lastly, I would say that under the changes to the federal nursing home rules during the Obama administration, one of the changes they made was that nursing homes have to have a designated person to handle grievances, and the nursing home is required to respond in a timely manner to grievances about care or services, etc. And they have, upon request, they have to do that in writing, so you can actually get an answer from the nursing homes. They don't have to do what you want necessarily, but kind of along the lines of what you were saying, Pat, in terms of your different experiences. If they're not going to do what you want them to do, they have to explain why. So there is that level of accountability, and I think having it in writing, et cetera, is really important. It's something that we advocated for with the administration, and we're really glad to see that that's part of, again, the federal rules for nursing homes.
I just want to add one more thing.
Yeah, go ahead,
Because
Pat.
of this experience, this relative of mine is going to have surgery in the next few months and may have to go in rehab. And because of that experience, that individual does not want to go into rehab because of what happened. And it was so bad. And I took sick from it. I became seriously ill, so that my immunity went down, and I was sick for 6 weeks with a lung infection that I was hospitalized for 4 days during all of this. And it was just a horrible experience for both of us. Thank you.
Yeah. So Pat, I think Senator said he's be willing to kind of support you, if this comes back up again. So Richard, you mentioned about I heard you mention about the long-term care ombudsman program. You want to talk a little bit about that? Yeah, then I'll get to you, John. I see you. I just wanted to jump on about the
Sure.
long-term care.
Well, the
I was going to
ombudsman
mention that,
yeah.
but can you talk a little bit
Oh,
about
good.
that
Yeah,
program?
it's a great resource. Every state in the country has a long-term care ombudsman program, and the ombudsman work in New York in regional offices. So New York City has a regional office. It's housed in the Center for Independence of the Disabled, New York, and ombudsmen. They help residents and families. It's resident-centered, but they can help families as well, or friends, to navigate issues in nursing homes. They are authorized to look at medical records with the resident's permission. They have to, they can't just do it on their own, and they're authorized to go into both assisted living and into nursing homes under the Older Americans Act. So they don't have regulatory authority, like, they cannot penalize a facility, but they can really help residents in a more informal way. And they're a great resource for us and for some legislators as well.
Aren't nursing homes required to post the phone number of the State Department of
Yes.
Health and the
Yes.
ombuds program?
Yes.
Okay,
Yes.
but for
Yeah,
people
they
who
generally
aren't in
do, in
nursing
my
homes,
experience. Yeah.
do you have it on your website? Do you have information if they want to learn more about the ombudsman program? Because maybe
Yes.
that
Yeah.
could be a resource.
Yeah, we do. We also
So it's on
have
your
a link.
website.
Yeah.
Okay,
Yeah.
that could be another resource for Pat. Okay, John, I'm sorry. Go ahead. I know you had your head up for a while. Go ahead, John.
Okay, no, I just wanted to, make sure I was seen. First of all, thank you very much for the presentations. I mean, one of the things I took basically from the second presentation was that in many ways, this is not so much a funding question as much as it is a question of how the funds are spent.
Mhm.
And this, is an important point because, I mean, I know, frankly, through my own job, where we spend $100 million in city monies every week to be the city's share of the MMIS budget, which is basically Medicaid, that it's extraordinarily expensive program. And if the focus is only on funding more or increasing more, I mean, we really do run not just the risk, but almost a certainty of throwing good money after bad money. And it really is important of things that can be done, both at the regulatory, at the audit level, the legislative level, to see that that kind of a business model can be changed, that
Exactly.
the wasteful items that are dealt with can be exposed, can be penalized, which is really important. I mean, I know, for example, as I think people mentioned staff. I mean, there are staff people who make so little money that they basically have to do off the book work on the side in order to make ends meet. But again, unless you look at the structural matters, both in terms of changing, maybe demanding that a certain percentage of monies go into direct PS care, the direct care,
Mhm.
and capping certain administrative costs, which could be done legislatively, could be done regulatorily. Certainly, I would hope that such offices as the state controller's office, which does have extensive auditing responsibility, can take an aggressive role here. But I think, as I said, I think we have to look to those items because, I mean, if we're just talking about we got to give more funding, it's just going to go, into those kind of indirect administrative costs that aren't helping anybody. So, I mean, I'm asking both the state senator, anyone else, if there are any particular proposals really to try to address these matters because they're the matter I think that we could really increase the business model and deal with the structural problems, which I think are at the root of a lot of this problems. So
So
that's my
Senator
two
Dabo,
cents.
do you want to talk
Yeah,
about that?
John, I appreciate that, and John is correct. It's not so much I can say, oh, in the executive budget this year, the governor's putting in $50 million for nursing home projects, and we're trying to increase Medicaid funding. It is about how that funding is spent. That's the accountability part. Again, I want to thank Richard because he does put out a good, proud PowerPoint, and it provides a blueprint on where we need to go. That PowerPoint is from 2019, and that was obviously amidst the COVID pandemic. And as I stated earlier, the COVID pandemic certainly shed a light on what was going wrong with nursing homes. So post-pandemic, we take that information, that data, and we see where we've come since then. So the years 2022, 2023, the state did act on a lot of what the pandemic had revealed. So making sure there is accountability, making sure that the violations are now made public, make sure the reviews for the nursing home are now made public. The response plans have improved based on the COVID pandemic data, to make sure the data is accurate, make sure it's transparent. This is obviously the movement post-pandemic that we have done as a state. Again, make sure, to John's point, that the funding is, again, there's accountability, there's affordability, there's accountability. Again, making sure that we are spending the money correctly now. So I think a lot has changed post-pandemic, and to John's point, that the funding now has been, again, not only earmarked correctly, but also are we spending it correctly? And that is, again, a work in progress. We are far from being done here. We are, again, to Richard's point as well, we're far from being done here. There is much improvement that we still need to do post-pandemic. And part of that is making sure that the money being spent is, again, transparent, and we are accountable to it, making sure it's being implemented correctly.
Yeah. Richard, you want to add anything?
Sure. John, I think you raised some really great points. And actually, New York, several states, including New York, did pass a law towards the end of the pandemic that required two things. It put a cap on profits. In New York State, it was 5%. And it put a minimum spending requirement for direct care, something related to resident care, that is, of 70%. It's kind of low, but at least it's something. According to our study, nursing homes now, again, based on what they themselves are reporting, spend about only about 65%. So it would raise the bar a little bit. We're recommending that nursing homes be required to spend at least 85% of the money that they receive. That 85% comes from the requirement under the Affordable Care Act, so-called Obamacare, for insurance companies. They have to spend 85% of the money they receive on something for their customers. If not, they have to return it. Limits administrative costs and profits to 15%, which we think would be fair, for more than fair, frankly, for nursing homes. So New York did pass that. Unfortunately, it's been very slow in implementing it. It's been, I think, 2 years now. So we understand that the State Department of Health is starting to review facility records. However, I think it's worth noting, as Bruce mentioned at the start, that he reached out to a number of the provider associations, and they did not want to come today. They sued New York State when that rule came out 2 years ago. And so actually there were 3 lawsuits. One in federal court was dismissed just within the past couple of months. One in state court was dismissed just within the past couple of months. I'm sure that they're going to appeal. They have a lot of money, millions of dollars, to do that, and to delay and obfuscate, frankly, and to hopefully get that law weakened even further. But what they admitted to, I think this is worth noting, in their own lawsuit against the state to try to stop these very moderate requirements, they said that if those requirements had been in place in 2019, nursing homes would have had to give back over $800 million in New York. An average of the facilities that participated in that lawsuit, 239 were counted. They laid out how much they would have to give back if they were subject to a minimum spending of 70% or a maximum profit of 5%. And that came out to an average of, we computed it, and it's on our website, of over, from their lawsuit, which is also on our website, of over $2 million per nursing home. I mean, could you imagine what that could have done in terms of additional staff, or paying people a living wage or having decent food. Some nursing homes only spend $1.50 or $2 a day per resident on food because nothing requires them to do anything better, and the Department of Health does not enforce the requirements around palatable and nutritious food for nursing home residents.
Thank
So
you, Richard.
you asked really good questions, and they have been responded to actually by New York State legislators.
Okay, well, thank you, and I hope you continue the efforts, because I think that's where, I think the longer term remedies can receive the resources to be able to be implemented. So thanks again.
Thank you.
Right. Thank you. So are there any more questions from the audience? Anicia, go ahead.
You're still muted.
I'm going to try to unmute you. Okay, Anicia, you unmute?
She's trying.
Yeah. Anicia? No, you're still not.
There we go.
Okay.
Yeah.
I just 2 years ago I had a knee replacement, so I had to go to a nursing home for disability, okay, to rehab for my knee. I will say that one department, the one that they took care of all the patients with surgery and that, I would have to give it a 5. They were excellent, but the rest of the staff, it was horrible. I should have just report all the things that went on. I was there, and for 20 days, they never gave me a bag. You know how to be 20 days without a bag? But that happened to me. Okay, and it was horrible. So I'm glad that mentally I was fine, because I had to remind the nurses to give me the medication, especially I'm diabetic, and I had to tell them, you didn't give me the injection today. So my experience with nursing home is they need to be more checked. They need to see why the employees don't care for the patient, because that's what it is. They don't care. They just go for work, and they need to have more humanity, because these people are sick, and especially the ones that they don't realize what's going on is very sad. That's all I have to say.
Okay.
Thank you.
I just want to piggyback on a little bit what Anicia was talking about. And again, as I said earlier, I spent many years working in nursing homes. And I can tell you, when people tell me I have to go into a nursing home, what I try to encourage them to do is, as many family members and friends that can visit. And the other thing I usually suggest is come at different times of the day. Because what happens, as we're hearing from feedback, unfortunately, there is understaffing. We'll get into that in a minute. But the concept, the squeaky wheel draws the oil. So if a family member is coming at 10 o'clock every morning, the staff begins to realize that they're going to make sure that person looks really great at 10 o'clock in the morning. We don't know how that person's going to look at 2 o'clock in the afternoon. So that's one kind of like a practical suggestion in terms of, without changing the structure, as hopefully maybe one day we could. But that's something that I would encourage people to do. If you have a loved one in a nursing home, try to get as many people to visit, or if you can visit, don't visit the same time every day. Go different times of the day so you get a better sense of the care. Anicia, did you have any other questions, or?
No,
Okay.
I just had to say that for the
Okay.
purpose that they take care of elderly people that they're not, aware of what's going on, to have more humanity on them.
Right. So, Dr. Renee, you
Yeah,
have a question?
I had for my mom a pretty nightmarish experience. The room was small. I used to visit her every day, different timings, so to see what about the accountability. And they would just sedate her all the time so that she would not have any exercises, no physical therapy. Ultimately, to cut it short, I had to call 911 and get her out of there and put her in the hospital for a couple of days, and never brought her back to that nursing home. So it's I think it cuts across the board. There are a lot of people who have had not so great experiences with their loved ones or with themselves as well. So with that kind of substandard care, we need to get this thing ASAP in the fishbowl so that we can get these things moving. And for patient care, this is not good.
Right. So, any more questions? Because I just okay. So, Senate right after as the pandemic was winding down, the Senate held hearings on nursing homes, and it was like all-day hearings. Richard, I think you may have even testify. I think I saw you testify at the
I think
hearing.
so.
And one of the things that I remember specifically about staffing, there was, yeah, even the industry acknowledged that they have challenges with staffing. And I think part of the problem, of course, is pay, but it's not only pay, it's also, I know even when I was listening to the testimony, they were talking about trying to create some type of career paths for people, for staff members. So that if, let's just say you're a nurse's aide, that you can then get, maybe you be encouraged to go to school and get your RN or LPN. So I know that we're trying to do that. And as Richard alluded to in his presentation, staff turnover in a lot of these nursing homes are extremely high. And it's hard to get people to commit because the pay is not so great. So, but I think that, at least at the hearing, from what I remember, that was a really important point that I think was being made. So do we have any more questions for the panelists? Okay, well, I think this is a very productive discussion. And Senator, I think you got some feedback when you go back to Albany in terms of ideas, and Richard will share, and we can share what some of his research is with you.
Yes.
And maybe you can use that as ammunition to try to see if we can get some of these things changed, as John alluded to, that they require certain structural change. And yeah, that's what makes it hard. On one hand, yeah, it'd be great for nursing homes to have more money. It's funny, when I did reach out to somebody from the industry, one of his questions to me was, do you think the Medicaid rate could be increased for nursing homes? But then my concern is what John was saying and what Richard raised, that where's the money going? So if you give more money to nursing homes, the current structure, it's not going to go where we want it to go, which I think what we're trying to say here, it needs to go to staffing. It needs to go, you need more nurses aides, you need more LPNs, you need more RNs, and also rehab people. So so hopefully that could be a message, Senator, you could bring back to Albany.
No question, Mark. And again, I appreciate the opportunity of being a panelist here and sharing it with Rich. The bottom line is, you have to still advocate for funding. Yes, there is an issue with implementation and obviously tracking the money, making sure it's well spent. It's not enough to say we increase Medicaid funding or the reimbursement rate, but it's actually how we spend it. Make sure it's being spent reliable and obviously credible. So we still advocate for funding, and then staffing levels. Even pre-pandemic, it was hard. It was hard to recruit. It was hard to retain. We had staffing struggles previous to pandemic, and obviously now the pandemic, post-pandemic, the issue is still there. The need for staffing is still there. So we obviously need to work on our staffing issues, pay and benefits. But the idea here is to try to retain and recruit as best we can and make sure we follow the money trail, making sure it's credibly spent. So to look forward to working with Rich. As far as my constituents complain about issues with nursing homes, highlight the issues that are there so that the electeds can work on those. So that's on the local level, and on the state level, again, in Albany, funding, implementation, standards, making sure there's oversight, and working those issues through as well.
Yeah, Richard, you have any kind of like final comments? And I do have one more question. Richard, go ahead.
No, just thank you for your thanks. It was a very interesting conversation. Thanks very much, and appreciate meeting Senator Adebayo.
Okay, so I guess again, as I told you, I worked in nursing homes for many years, and the actual structure of how a nursing home runs and how they provide care. I know, for example, I don't know if people are familiar, the Senator Richard is familiar with something called the Eden alternative. I don't know if either one of you heard of the Eden alternative. Again, I'm getting very concrete because when you work in a nursing home, there are certain ways the staff works together. And that's like one model that I could talk about. Another model that I know that I've read about, and I know one nursing home we actually try to implement it, is concept of 24-hour reality orientation, where the staff work together to orient people to their surroundings. and especially with people with dementia, even though it may seem challenging. So even like when the nurse's aide goes to change them, they say, "Good morning, Mrs. Smith. Today is, February 25th." And then when the maintenance guy goes in, he say, "Good morning, Mrs. Smith. Today's Tuesday." So I guess I'm suggesting certain models that are out there. And I just wonder if there's, from your experience, either Richard or the senator, have you heard about any of these type of newer models that some nursing homes are trying? No.
No, and I'll take a look into it, Mark. And of course, you can email me further information, but I'll take a look into it. But
Okay.
as of to date, I have not heard of any of those models.
Okay. Well, again, I think this is a very productive discussion. Thank you all very much for coming. And this is the
Thank you.
tape, so just watch for it. And Richard, please send us your slides. We really
I
would
will.
like to
Thanks
share
so
them with our community. Thank you so much.
Great. Thank you. Bye-bye now.
Take care, everybody.
Stay safe.
Bye-bye.
Thanks for coming, everybody. Thank you, Mark, for everything that you did to put this together. Thank you, Senator. Thank you, Richard.
Thank
See
you, Mark.
all
Thank you,
soon.
Bruce,
Take
as
care.
well.
Bye-bye.
Everyone, have a great night.